Panda juu. Umepinda hivi.
Huyu anakuangalia mara nyingi.
Hivyo hivyo.
Tulia hivyo.
Pole.
Tulia.
Sasa tunaweza. Pole.
Sikiza tangulia.
Kafu kweli.
Yote utaliuma.
Sasa kwa nini ukarudie?
When you look at standards, sometimes you ask yourself, which standards? Because standards are in a context. You can't get a service of $100 by investing $1. So you have to do with that situation. It's not a good situation, but it is a situation that one has to try and do the best under the circumstances. When you go around the hospital, you will notice that most of our wards are overcrowded. For example, in one ward, we have only 28 beds. But the number of patients in that ward is 58. And one solution is to try and have more of these centers which can give cancer treatment in the regions, making health professionals more aware of Bucky's lymphoma, giving them the knowledge and skills to treat Bucky's lymphoma children appropriately. That's where this project now comes in.
What was the diagnosis?
Malignant process sarcoma. Therefore,
Malignant sarcoma?
yes.
It's from the village, eh? So it took a long time to get to the hospital. Pathetic situation, if I'm to say. Was taken to the health center, and in those health center, in those dispensary, we have the lowest cadre of the medical practice. So they kept on saying, okay, the child is going to recover. And sometimes they go to traditional healers, by the way. A lot of them, they have been claiming that they are able to cure cancer and telling the person they shouldn't go to the cancer hospital because they can cure. So I stayed for quite some time waiting for natural healing, and then he was amputated. That's why we have been trying to record a lot of TV programs. Dr. Ngoma has been doing that a lot, trying to reach people through media, telling that, please, when you have these symptoms, run to Ocean Road. But he does not say, never run to traditional healer, because that will create a very huge conflict. Please run to us. We can do something. We can do this and this and this, you know.
If you try to ask them, have you seen other children in your village like with same story? They say, oh, there are a lot of them. So we use the mothers who come here with their children to go and talk with others that this is a disease which can be cured early.
It's the sick who counts more from the outlook, but while she's here, she's also thinking deeply about those who are at home. So I can tell you that she never had peace. When she's here for 6 months, she never had peace. You left those one at home and you are not sure if the father is taking care of them very well or he has gone to drink, and you know. Perhaps we may not be really very, very, very good fathers in terms of being very close to children. I don't know. But our wives, really, our women play a very, very great role in our children. You know, I can tell you. Ujambo, is he happy? These are the very difficult patients, because sometimes when the mother look at that, he starts pushing things, he wants to go home. He can actually even tell you that my uncle has died. And that yes, the tumor is not seen there, but still he has a chance of relapse, so he shouldn't run away. If you look in terms of remuneration, it's not good. But the outcome I get sometimes from these children keep encouraging me that, look, let me do, let me work. Let me work. Keep on running.
In a country like ours, every year we get about 700 children who develop Bucky's lymphoma. Before the project started, only about 70 got treatment. But with this year of raising awareness, a lot of media involvement, a lot of training of health workers, things have improved. So we are reaching about 50% of the children who get Bucky's lymphoma. Njoo wewe kaa hapa. Kaa hapa.
Alipoanza kuugua huyo alikuwa na matatizo, alivunjika mguu. Tukampeleka hospitali ya Songa. Ndio tumekwenda tukakaa naye kule tukapata matibabu. Ndio tumekaa naye ndio tukakuta uvimbe umevimba.
Uvimbe kwenye shavu au kwenye mguu? Kwenye mguu.
Wakamoa mchukue wakataka kwenda kumpelesheni mguu. Kwenda kule kumwangalia ukaona hawezekani kumpelesheni. Ndio akatuandikia barua mtoke hapa hospitalini muende Ocean Road. Ndio tulipotoka hapo kwa Songa ndio tukapita
na shavu lilikuwa limevimba lini?
Na shavu likaanza kuvimba huko.
Before they came to Ocean Road, they went to the traditional healer. But then they, for 3 days on there, and then they got the fare, so they traveled to Dar es Salaam. If they couldn't, they didn't get the fare, then it means they would have spent all the time in the traditional healer. So you can see how resources can change things. Yeah. She had a Bucky's lymphoma on the jaw, big tumor here. But if she opens her mouth, there is nothing you can see there now. Usually you could see the tumor there and it would be here. But she's fine now. She's fine. Okay? Yeah? Cheka basi, mama anakuambia ucheke kidogo.
Wewe sio unataka Ocean Road? Cheka basi tufuatane naye tuondoke.
Na nitakuachia nauli uje Ocean Road basi.
Umesikia? Cheka basi, chekia basi mwanangu. Usome Christmas nitaka Ocean Road.
Unataka Ocean Road tule kote Christmas eh? Nikuachie nauli uje Ocean Road. She says she wants to go with us to Ocean Road. Yes. This is a good and a success story.